And it's darker than that in some ways, in that the pills that we would give for that headache, Tylenol, ibuprofen, these drugs have immediate consequences in the microbiome, in the liver, in the kidneys. We're damaging systems with the very things. And if we go back to the pneumonia one, it's very interesting because it seems very simplistic. Bacteria overgrown in the lung. We should give an antibiotic.
Yeah.
That seems so obvious and so benign. Well, let's just give them the antibiotic. What we now know is that as soon as an antibiotic hits the system, within the next 12 months, the risk of that person developing major depression goes up by 24%. If you give them 2 courses of antibiotics in that year, their risk of being a major depression goes up 44%. And so here we are treating pneumonia or a urinary tract infection or a sinus infection. And what we're really doing is undermining the entire metabolic capacity of their gut-brain axis. And we are predisposing that person to a loss of sense of self-identity. And they develop that deep major depression, the disconnect from self, because self is not a single species. Self is the description of your relationship to nature, the nature within you. And so when we give an antibiotic, or we give ibuprofen, is a scary one. So ibuprofen